Good morning.
Good morning. How are you this morning?
I'm doing good. I think I've figured out a way to reduce my technical difficulty. So this morning I actually have a wireless charger taped to the back of my phone, and I am using the phone to do the audio and visual. So hopefully it turns out well.
Perfect. I saw on the Riverside um, app that we can make like emojis now for ourselves, or our, I don't even know if they're called emojis. We can turn our
Avatars?
avatars. Yeah, we can turn ourselves into like pandas and stuff.
Oh my gosh. I think I would be adorable as a panda,
You
actually.
would, you would. So that might be something we have to look into
Yeah,
to,
for sure.
be able to post some fun videos. So, anyway, I thought that was cool.
Yeah. We'll see if I have the technical ability and or if we're paying for that level of subscription. So
Good. That's a good point. We probably aren't.
this budget
Budget,
production.
budget production. People are just gonna have to deal with our faces. That's if we decide to post our faces. I don't know. We haven't necessarily gotten to that point yet. So,
Yeah, I mean, I did one and I had to do it because it was the
yeah,
introduction to our closet podcast.
in the closet. Yeah, it was
Yeah.
great. It was a good one. So how has school been going? You've been in school how many weeks now?
I'm just starting the fourth week of massage therapy school,
Mm-hmm.
and it's pretty intense, honestly. I was telling my partner it feels like an immersive Spanish or maybe Latin. Latin, of course, we'll say Latin.
Yeah, you're learning a new language as well.
Because everything is literally just Latin terms, right? We have to learn all of the muscles of the body, the connective areas, what the joint names are,
Yeah,
the skeletal system. And so
right.
it's a lot. Um, but the class is going really well. So I'm happy, it's engaging, and I'm really looking forward to putting some of these things I'm learning into practice.
Mm-hmm. Awesome. That's great. When do you guys, so when we do our training in psychotherapy and we start thinking about our own modalities and how we're going to work with our clients. So, when you get trained to be a psychotherapist, there's these different schools of thought regarding why humans develop psychopathology and the best way to treat it. And this, you know, allows you to develop a case, conceptualization, and then that guides your treatment. So some people will be drawn towards, humanistic theories or psychodynamic theories or cognitive behavioral, and there's a whole bunch of different kind of, modalities. Um, in massage therapy, do you guys have a similar kind of pathway for kind of choosing the way that you approach the human body?
Yeah, absolutely. One of the reasons I picked the school that I'm attending now is because they're really focused on the holistic body, right?
Mhm,
And so there are multiple different massage modalities available.
mhm.
Some of the up and coming ones right now are like polarity therapy, cranial sacral therapy. Um, there's a bunch of new kind of discoveries, just like science is
Yeah,
always evolving, right? We're discovering new things and how
yeah.
the body is connected to the mind and
Mhm.
how one can influence the other. So, what
Right.
I really appreciate about this school, particularly, is that they're kind of exposing us to all of them
Mhm.
and allowing us to gravitate towards what we are most feeling in line with. And so, um, something I had not considered until recently, because as soon as I take on a new hobby, you know this about me, but our listener may
Yep.
not, right? As soon as I'm like, I think I want to do that, I immediately go and grab any and all information. Like I start my own almost dissertation, right?
Right.
I want to do all the research. I want to gather as many facts as possible. And so one of the things that I do is I always look for podcasts that align with the
Mhm.
topic that I'm interested in. Because I'm like, I want to hear it just in the background, reminding me, learning new things. I'm all about it. And so I've been listening to a massage therapy podcast, and it's two massage therapists out of Australia, and they have like a really wide range of guests on their show. Some of them talk about business aspects. Some of them talk about just like their struggles of becoming a new therapist and how they
Right.
finally were able to establish their practice, what modalities work for them, and why they were interested. And last week or the week before last, they had a woman on, and I cannot remember her name. Otherwise, I would like give her a plug. But she's in
Right.
Australia, so you wouldn't be able to go see her. But she's pretty famous in that region for taking on chronic pain patients. She has like a 4-month waiting list, and people are driving 3.5, 4 hours
Oh my
just to
God.
be treated by this woman because she has such a
Yeah.
good success rate.
Mhm.
And so that was something I hadn't really. I mean, we've heard of the traditional methods of massage. Like I think the majority of people either go because they've worked out, right? There's sports massage. I worked out
Mhm.
and I need a massage because my muscles are sore, or I'm stressed out and I really want to relax, right? And now
Right.
there's lymphatic drain is a little more popularized for like post-surgery recovery and things like that. But there's
Right.
so many more things that it can be used for. And I don't think that general population of society, unless you're interested in massage and go into a deep
Yeah.
dive like I did, are really aware of those. And I had not considered massage for chronic pain until that moment. So that's something that's really kind of perked my
Yeah.
interest.
Yeah. Chronic pain is like such a uh, it's it's a topic that is so common and experienced by so many people. And the difficulty with chronic pain is I know a lot of people with chronic pain feel like they can't express the fact that they have chronic pain, and they have to kind of go through their life feeling like a lack of support because they don't want to like bring people down. They don't want to like bring the vibe down, but it's like they're trying to navigate ways to deal with this pain. And it's probably really impactful to have a massage therapist, right? Be able to come in and manipulate their bodies in ways that can make them feel better, as well as give them some exposure to movement that maybe feels scary. Because I know a lot
Yeah.
of pain patients, chronic pain patients, a lot of kind of what causes this chronic pain cycle is like fear avoidance. Like, so it's like fear of more pain. So that makes sense to me that a massage therapist can maybe introduce more movement in the muscles in a way that feels safe.
Yeah. So we're learning a lot of passive stretching and passive range of movement as part of this course. And um, so we know with massage, just in general,
Mhm.
that it can reduce inflammation and improve circulation. And that is going to also encourage the release of endorphins and serotonin, which can
Mhm.
help, just like general depression too.
Yeah.
Also, physical touch can relax the nervous system in a way that other modalities just can't do that.
Mhm.
And I think tying those together is really important. One of the things that we learned last week, I think it's called, oh man, my instructor's going to be so mad. Tensegrity. I think it's called tensegrity.
Okay.
That could be wrong. Okay, but
It's
I'll
all
just
right.
explain the general
I
principle.
have no idea if it's wrong, so I'm just gonna go with that
Okay.
word.
Hopefully there's no massage therapists or physical therapists listening to this. If you are, you can correct me. Okay.
Please put
I've
it in
heard
the
the word
comment put it in the comments.
I've heard the word once. Okay. It was demonstrated once. We have not covered it as a topic. It was like a sideline conversation.
Okay.
Um, but the way that the tensegrity assessment happens is you kind of just look at your patient standing upright, and you're going to notice a portion of their body that looks more tense, right? Someone may be standing
Mhm.
posturally, like with their chest out or their hip kicked to one side, right? You're not so much looking at symmetry of the body. You're looking at where does the body seem to be pulling.
Mhm.
Once you go to that patient and put your finger, like you're going to put light, like not even 1 pound of pressure, you're going to put slight pressure
Mhm.
onto that area that's holding that tension. And you're going to feel the body relax, and you're going to feel that tension shift to another area of the body. And then
Mhm.
you kind of trace it like a spider web, right? You're going to put your finger,
Right.
like, say it was on my left shoulder was the start point. You
Yeah.
put your finger there, and then it shifts down into my front right rib cage, right? That's where I'm now tensed up. And then
Yeah.
we're going to push there, and then we realize, okay, now that's into the glute, right?
Right.
And so
Right.
somebody who's having neck pain, say, they come to you because my neck is hurting, people are going to be like, well, let me rub your neck. But
Right.
what I'm learning with all this new Latin is that the body is very complicated. I think we all know that. But there are so many muscles connected to other muscles,
Yeah.
nerves, ligaments. Your veins can have issues. Like there's so many things that could be wrong. And your body is meant to protect itself. Like
Right.
it wants to make sure you're not feeling pain. So it will overcompensate in other areas,
Yeah.
which then cause, second and third level effects. So if I want to
Mhm.
fix your neck pain, I might have to start at your glute, relax your glute, which is going to relax your thoracic spine and get that all relaxed before we can even get to the neck. Because if I'm just pushing into the neck, there's so
Yeah.
much other things that are happening, right? And I think that with chronic pain, that also can be a lot of the issue, right? What's
Mhm.
actually presenting these signs, we'll say, that are because there's things that we can see, right?
Yeah.
Or symptoms may not be the actual cause.
Right. Yeah, I've actually had this experience on many occasions where so I don't want to say chronic, but I have a history of experiencing low back pain like everybody else in the world.
Anyone over the
I,
age
I
of
think
35.
I yeah, I mean I'm in my 40s, right? But I started experiencing low back pain like pretty early, like in my 20s. And so I did the whole thing. I did, chiropractic care and, stretching and like strength training, like trying to do all the things. And I just kept having like this reoccurring, like low back spasm, basically. It was just kind of like my low back would spasm up and then I would be unable to walk for or like move or sit. It was like the minute I tried to get up or move, it was just like a sharp pain in my low back and I would just be debilitated and like laying on the couch or bed or whatever. Um, but it was always like a slow creep, to that point of having the back spasm. Like it would usually start with, like weakness in my knee or my thigh or my shoulder. Like you're saying, like it would happen somewhere else in my body first. And then as I began to try to like protect that part, the part that maybe was injured in my neck or whatever, the compensating for that would then lead to an imbalance in like a different part of my body and then eventually that imbalance would lead to an imbalance in my low back and then now we're like dealing with problems all over my body, right? And so then eventually I got physical therapy and the physical therapist kind of did exactly what kind of you were describing, this process of okay, let me just look at you. Like, let me just stand there. She would just kind of have me stand there and kind of see, like, am I leaning more one way than the other? Like, she might have me walk or lift up my arm and kind of see, like, is there an asymmetry going on? Is that a natural asymmetry? So it was like really fascinating to see how she was able to pinpoint where the weakness was because usually it was like for me it was weakness in my glutes, it was weakness in like my core, that was leading to my low back trying to take on all the work of my glutes and my core. So my physical therapy was really just finding that imbalance and then treating it. And then that led to me being able to really not have any low back problems anymore. So it makes sense that this compensating part, would lead to chronic pain.
Yeah. I also learned a little bit about that back in 2017 when I had my car accident, right? So
Yes. Yeah. Yeah. Oh
I
man.
had like the weirdest, and they couldn't even figure out why. Like my back would just constantly hurt, but there were certain motions like touching my chin to my chest, like lowering my head. And at that time I went to church, right? It's like bow your head to pray. And I was like,
Yeah.
I literally cannot put my
I'm
neck
sorry,
down,
God, I can't do that right
it
now.
feels like my spine is going to explode, right? Or
Yeah.
looking up, like really just moving my neck up or down caused
Mhm.
this just pain in the middle of my back, right? And so the thing that I really found interesting during that experience, actually, you had gone with me to that doctor. I got
Yeah.
sent finally after the 6th month. I got sent to a chronic pain specialist up in Tucson, and he did a test, and he figured out what was wrong. But I remember sitting in that lobby, and I was like, my pain is really mild. Like I'm watching people come in with like crutches and wheelchairs and walkers, and I'm like walking into this chronic pain clinic thinking, am I overreacting? Like, clearly, I'm not in as much pain as these people. Maybe, maybe I'm just overreacting, right?
Yeah.
And then I talked to the doctor and he's like, what level, did your,
Gaslighting yourself?
what,
Just
me?
gaslighting.
Never.
There's nothing wrong with me. I'm clearly the problem here, being in
Obviously, I am making this up, right? That's literally
that's that's crazy talk. That's crazy
okay.
town.
So the funny thing was that, so here's the impact moment where I was like, wow, I had not even considered this, right? He said, what was the pain level when it started? And I was like a 7, right? A 7 or 8. It was pretty
Mhm.
bad. And so it's been 6 months. He's like, okay, and now you'd put yourself at a 3, right? And I'm like, yeah. And he's like, the pain has not gone away. You are just, it's like with anything, right? With time, it seems
Mhm.
less traumatic. It's like carrying an emotion. Like, okay, it was
Yeah.
really intense today. Tomorrow it's going to be less intense. And the next day it's going to be less intense. It doesn't mean you're not sad anymore. It means that the emotion isn't as strong. And
Right.
the same thing happened with that chronic pain. And
Mhm.
so I was like, that is a really good way of understanding that our mind, our brains will
Mhm.
protect our body by gaslighting us, right? It's like,
Yeah.
hey,
Yeah.
it's actually not that bad. You're good, right? Or you're
Right.
just used to it. So you're like,
Yeah.
well, it is what it is now. And you just
Mhm.
carry on with it. And so
Yeah,
thinking about,
your new baseline becomes pain.
yeah, yeah,
And that's the same, you're right. I mean, that's the same thing psychologically. So we see that with people. I can't tell you how many people who my initial question is, have you ever experienced a traumatic event when I'm doing a clinical interview, right? These aren't like my therapy patients. These are just people coming in. They're not sure what's going on. And I might say, have you experienced a traumatic event? And I can't tell you how many times somebody will be like, no, 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 not at all. Never. And then once I actually get through the clinical interview, I start to discover like, oh, I've actually been shot at. I've actually, rolled over, crashed the car this many times, and you start to see the symptoms. But for them, it's their baseline. Like
yeah,
hypervigilance is their baseline. Anxiety is their baseline. Depression is their baseline. So when you ask them, it really is like, no, I'm fine. This is normal. Like this
yeah,
is, so it makes sense that with the body, pain could become the baseline for people where they're like, no, I'm fine. But really, like
yeah.
you said, you just adapted from a 10 to a
Yeah. It
3.
reminds me of that. You remember the old, like, okay, when we all had regular TV, right?
Yeah.
Before all these streaming things. But they had a Claritin commercial where they like throw this image up and it's like Claritin clear. And then they peel off this like thing. And then you're like, oh my God, like I didn't realize how blurry it was until they peeled that out. And then it's like crystal clear. And it's such a good trick of the mind, right? And I think
Right.
about that. It's such a good analogy for so many things, though, where you're like, well, it doesn't seem that bad, right? Or
Yeah.
it feels
Yeah.
normal until you see what it could be. Like, oh,
Right.
this is, or like, it's, I would say that's even better. The eye doctor test, like number 1, number 2, I'm always guessing. I'm like, I don't, I'm not sure. That's probably why I can't see still, because I don't know.
It's why your prescription is wrong every single time you go.
I don't know. You tell me which one is better. It's just a
Okay,
trick question.
can we side note for a second and talk about the fact that last year you had to get like 5 different prescriptions because every time you went, it was like a different prescription? Like,
Yeah. So I also want to caveat all that wasn't my own fault either, though. So I
but
wasn't
are we
completely
sure?
guessing.
Are we sure?
So what's crazy is, so I think what was happening was my reading vision was messing me up, right? And then they're doing,
Right.
and I had never had a reading prescription before. So they're
Yeah.
doing these like distance things. And I'm
Yeah.
like, I don't know, like it seems a little off. So they put me
Right.
into this prescription, and then like I could see, and then a month later, couldn't see anymore. Like I
Yeah.
had perfect vision walking out of there. I'm like, boom, cured. One
Yeah.
month later, I'm blind. Like
Crazy.
I went from 2020 to 2070 in 1
Yeah.
month
Yeah.
out of my left eye. My right eye was fine. My left eye was like, I don't know what's going on. So I had to go to a specialist. My eye dilated like 4 times. It was $1 million, by the way, I had to pay
Yeah.
with
Oh my
insurance.
God.
And then they changed my prescription. They're like, okay, well, it's even blinder now. So they like put my
You
prescription
just kept
higher.
getting more blind every time
Right.
you went.
And then this year in February, I went back, like I went to a different doctor because I was like, I can't go back to that one in Sierra Vista. My insurance changed because I changed my vision insurance changed through work. So I went to a different, I was like, I'm just going to find a random one. Let me find one with good reviews, right? And so I ended up going
Yeah.
to Tucson, and they they literally put me in there, and they were like, started me at my prescription. I was like, nope, totally blind. And then the lady like went the other way, like higher prescription. I was like, even more blind. She's finally like, hold on a second. She like boop, flips it over. She's like, how about this? And I was like, it's perfect.
Oh, it was the holy
No
sound.
prescription. It's no prescription.
What?
Zero prescription in my left eye. I was like, how the hell does that happen? And
Yeah,
they
that's
said that there's some weird like obscure things where like stress can actually impact your vision.
oh,
It will like stress your whatever that nerve is in the back of your eye.
interesting. Yeah.
And yeah, so they were like it's pretty rare, but that could possibly be what
Yeah.
it is. So I don't think I
That's
was faking
actually
the eye doctor test. I think that
yeah.
now that I've walked away from my last job, I'm pretty sure it was
It was
probably
stress.
stress. But they try to tell me like, oh, it's dry eyes. And I'm like, I've had dry eye every time I've come in here for the
Yeah,
last 15 years. And why would
right.
it only make my left eye blind? Like it just doesn't seem right.
Yeah.
So
Oh my
anyway,
God. I I have had dry eye for for a long time now. I feel like it's just getting worse and worse and worse, and I'm just really sad about that.
listen. So okay, we've really gone on a side tangent here, but I
We
do want
have.
to tell you, taking allergy medication dries your eyes out.
Oh. Yeah, and
Yeah.
I take it every
Mm-hmm.
day
Yeah.
because I literally will die if I don't. I'll be
Literally, one of the
sneezing.
treatments for dry eye is like stop taking your allergy medication. So you're
Okay.
like playing a game there where
I
I mean, not
know.
all of them, but a lot of those like Claritin and
Yeah.
Zyrtec and stuff can actually increase your dry eye.
That
So
makes
you've
sense.
moved to Texas where there's a billion allergens and
I
humidity.
know. My allergies got so bad when I moved here.
So did
They
your
weren't
dry eye, huh? Because you've been
so did
taking all of that
so
allergy
did my dry
pills.
eyes. Even though I cry every day because you're not here, it doesn't help. It doesn't.
Okay. How that's something that's interesting, right? Because I was like, I cry every day at work. My eyes are clearly not dry.
I'm crying at work, and my eyes are still
All
dry.
day and I can't read shit. So explain that, doctor.
They can't do it.
Oh my gosh.
But this is actually a really good segue into stress and chronic
Yeah.
pain
Yes. I love
and
it.
like the impact
Look at
of
that tie back.
look at us. Look at us
We're
go.
so good.
um one of the frustrating things for me is whenever I try to communicate to people the impact of stress on their lives, I think people like are so used to hearing like manage your stress, and I think there's almost a like, yeah, yeah, I know, like in one ear, out the other. And I want to like caveat that I do recognize that there's a lot of um societal issues and issues of resource and privilege and things like that, to where some people just don't have the capacity maybe to change their environment or manage their stress as much as they would like to. So like obviously that goes without saying, but even those of us, any person can still find ways to manage their stress better. I think all of us can probably. And stress has a significant impact on our chronic pain, and on our health as a whole. And the reason is that we are a nervous system. And imagine that. So when we are stressed, our bodies release, a whole bunch of chemicals. And one of those chemicals, the stress hormone cortisol. And cortisol is not a bad thing, but if we keep triggering our nervous system that, something is a danger, something is a stressor, then we're going to keep releasing this stress hormone, and then this is going to lead to inflammation throughout the entire body. It's going to lead to difficulty sleeping. It's going to lead to, which then difficulty sleeping leads to difficulty repairing the body. So we repair our bodies when we're asleep. If I'm not sleeping, I'm not repairing. If I'm not repairing, I'm going to continue to just have this cycle of chronic pain. So we get into this stress cycle where our bodies are not repairing. We do this long enough, we end up with autoimmune conditions, and we end up with chronic health conditions. We end up with heart disease. We end up with more allergies. It actually decreases our immune function, so we end up getting sick more often. So stress is huge when it comes to chronic pain. Like I can't emphasize that enough, about how much that impacts our capacity to feel good.
Yeah. Massage can also, just to plug in here for massage,
Yeah.
massage can reduce your cortisol levels as well,
Mhm.
and it helps promote better sleep. So those are two other like findings that exist in that
Yeah.
area.
Yeah, it
You
makes
just reminded
sense.
me. Oh, go ahead.
Yeah. Oh, I was just gonna say, one of the you were talking about physical touch earlier with massage. And I'm like a big physical touch person. Like I love physical touch. So I'm always trying to like hug people and be close to people and sit next to people because physical touch actually releases a neurotransmitter called oxytocin. And oxytocin is basically helps kind of clear your nervous system of like cortisol. So it is like a calming, connecting neurotransmitter, for the body. So it makes sense that massage would kind of help people get some of that chemical in their system to
Yeah.
feel better. So anyway,
Yeah.
that's
Yeah, they
exciting.
can. There's also, like we just talked about the different massage modalities earlier.
Mhm,
There are several modalities that are less, I'll use the word intimate, right? Like,
mhm,
so I think a lot of people think of just like a full body massage,
mhm.
right? And they're like, I don't want to have to get naked, and I don't want to have people touching me here, or like you feel very vulnerable,
Yeah.
especially if you have experienced any kind of, maybe unwanted touch
Mhm,
previously or trauma around that.
mhm.
But there are some lighter modalities that can introduce touch in a safe way to help people with some of those, traumatic experiences around touch. A lot of sexual assault patients, right,
Mhm,
will um, learn safe touch again through some of
mhm.
these massage modalities because the body um, can hold that trauma.
Yeah.
And I think that was made apparent to me again through that when I had that car accident, right? 6, 7 months later, I'm driving, and anytime I saw a car on the side of the road, like kind of positioned how my accident started, my body would clench and I would immediately feel that pain in my
Yeah.
back, right? And I'm like, nothing's even like we didn't do anything.
Yeah.
But it's that mind body connection where it's just like, do not let that happen. I'm warning you right now what is going to go
Mhm.
wrong if this occurs again. So working
Right.
through some of that is really important. I wanted to add one more thing though, because you were talking about the cortisol levels and stress.
Mhm.
I think it was back in like 2013, 2014. I found it was back when TED Talks were amazing.
Yeah.
Again,
Yeah.
looking for information on stress reduction.
Again, just as nerdy as I am, which is why we're best friends.
I just love information. I mean, okay, knowledge is not just power, it can help you understand things in a way that also eliminate the shame that you carry for
Mhm.
feeling this way or that way, right? It's like, just help me, now I understand, like, this isn't necessarily me. But anyway, I digress. So I found this TED Talk And I cannot remember the doctor's name, but you can Google it. It's still out there. You can find it. It's on YouTube. Um, Why Zebras Don't Get Ulcers. So he wrote a book called Why Zebras Don't Get Ulcers.
Mhm.
And one of the most important takeaways I got from that the TED Talk that I watched, there's a short one and then there's like the full hour long one.
Mhm.
Um, your body does not know the difference between, so your body releases the same chemicals
Mhm.
when you're almost getting hit by a car or when you are running late for work, right?
Mhm.
It doesn't know the difference between like, this is a serious life and death emergency, and I have anxiety because I'm running late or I may, I don't want to disappoint this person. And
Correct.
so
Yes.
your body is continually releasing those
Mhm.
toxins. And it's not like I'm a baby rattlesnake and I can't control the amount of venom that I release. It's just like that alert goes off, like the whistle goes off, whether it's, death or
Mhm.
random stress, traffic, whatever it is. I forgot to put the garbage can at the end of the road and now the
Yeah.
garbage truck's not going to get it, right? Your body
Yeah.
just starts pumping that out. It's like, boop, default. Let's
Yep.
pump all
Yep.
these things out. And so being able to recognize that for one, and then seek out things in your life that can help reduce that or are going to kind of bring you back to that baseline. So I just thought that was a really cool um, analogy for how the human body works and how the stress responders are going.
Yeah. So the author of the book that you're talking about is a psychologist, I believe, at Stanford, and his name is
Yes.
Robert Slotsky, I think,
Yeah.
something like
Yes. That
that.
sounds exactly right.
Yeah, and he has amazing lectures on YouTube, by the way, which I have watched.
I don't think we've ever talked about this before either. So this is great.
We have it, but he's great. I've talked about a lot of his lectures on behavioral genetics and like just human behavior. How um, we have plenty of examples of the impact of our hormones and our neurotransmitters and things like that, and yet I think we ignore the fact that these things are impacting and determining how we engage, how our behavior, what we end up doing. So, some of the examples he uses is like if you look at somebody who does steroids, anabolic steroids, they're trying to get, buff or whatever. They end up experiencing like a roid rage,
Oh,
right?
right. Yeah, I think that's the most famous
Yeah,
one.
yeah,
Roid
that's the
rage.
famous one. But there's actually stories of there was a really popular court case where I don't remember what the actual crime was, but a person was on trial for like I don't know murder or something. It was a aggression, um, and the defense ended up presenting that the person had like a sugar rush, like a sugar crash because they ate like too many Twinkies or something. Um,
That's going to be my
but
defense for everything. I had too many
yeah,
Twinkies.
right, right. But, there is, the amount of sugar does impact the way that we process, those chemicals. Think about like a monthly menstrual cycle and the way that that changes your behavior throughout a month. When we don't eat, we get hangry. So these are all just like results of signals, of chemicals and hormones, and our behavior determines how much of those or how well we kind of balance those. If we're not sleeping, if we're not eating well, if we're not getting physical touch, if we're not around friends, if we're not in the sunshine, like all of those things impact the amount of chemicals and neurotransmitters that are floating around in our brains. And to kind of go back to what you were saying about how our bodies release all this adrenaline, all these chemicals, it doesn't know the difference between like something made up and something that's actually in a rattlesnake. The same is true for chronic pain. So we know that like um, the stat is 30 to 50% of people with chronic pain develop depression. And depression itself lowers your threshold for experiencing that pain. So you're going to experience a heightened or a hypervigilance towards pain. And it's because the same part of your brain that lights up for physical pain is the part that lights up for emotional pain. there's no difference in the brain for where it's lighting up. So managing our psychology and the way that we are perceiving the world, like if something is stressful, it's really our perception that determines that level of stress. If it's not an actual rattlesnake, right? Or an
Yeah.
actual bear or something like that. So anyway, yeah,
Yeah.
I'm on board with you there. Yeah.
Yeah. I literally was just listening to podcast on my way home Friday from school, and it was talking about it was a psychologist and a what's the other one? Why can't I think of the word?
Psychiatrist?
Yes, the psychiatrist. I was
Uh-huh.
like, why can I not think of it? Okay, thank you, Dr. Staples.
You're welcome.
The psychiatrist was talking about how with prescribing medication for like psychological disorders, the patient's belief in the fact that that is actually going to help them will determine whether or not that medication works for them.
Yeah.
And that they've been able to show that the doctor-patient relationship is actually just as important, if not more important, than the actual medication themselves. There was like patients receiving the placebo that had a good client-doctor relationship actually saw better results than patients that received the medication and had a poor client-doctor relationship. So that really highlights the power of connection and your own mental state. Like you believe that, you know, there's an answer for this thing that's happening to you. People that have more of that kind of depressive state or I'm just never going to get better, typically don't, right? It
Yeah.
becomes kind of a self-fulfilling prophecy at that point.
Yeah. So there's an author in psychology. He was a psychologist. He was actually he's a Jewish psychologist, and he was in a concentration camp. And when he left that camp, he ended up writing a book called Man's Search for Meaning. And one of the things he talks about is the incredible amount of suffering and despair and that he witnessed. And he noticed something about the people who were the most successful in these concentration camps, right? This is literally the most heinous, horrific conditions. But there were people who seemed to be able to almost transcend that suffering, and be able to hold that suffering. And the people who were able to do that were the people who were able to assign meaning to that suffering. And so the most important thing, especially for like chronic pain patients from a psychological perspective, is really looking at how are they assigning meaning to this suffering. Do they believe that it's something about them that they deserve it? There might be some people who are like, I deserve to suffer. I did this to myself. I'm a terrible person. And then their pain is going to be very, very great, right? And then there's other people who might assign a religious meaning to it, right? Like, this is God's test for me to see if I can still trust him or still lean into him. And this gives them so much meaning to be able to like hold their pain and be able to navigate it with and that does decrease the amount of pain they experience because they are able to assign a meaning to it. So part of the therapy treatment a lot of times for chronic pain patients is really trying to understand how they are assigning meaning to their pain. What do they think about it? Do they believe that they can be helped, or do they not believe they can be helped? And it kind of ties into your practice of hypnosis, right? Like we've talked a lot about how like
Yeah.
hypnosis is something that works if the person like really has a belief that it can help them, right?
Yeah.
So can you talk a little bit about that, about somebody's belief and how that impacts like hypnosis?
Yeah. So I think that it just kind of goes along with pretty much anything, right? Someone that doesn't believe in a God isn't going to probably practice religion either, you know? We know that we all have a subconscious brain, right? Our autonomic nervous system is running all the time. We are alive, we're upright, we're breathing, all of these things are just happening automatically. You guys have ever had where you're just like daydreaming for a minute, right? You're not really controlling that daydream. It just pops in there. We all have that inner voice, that inner critic that
Mm-hmm.
pops up, when we're doing something and it's like, hey, dummy, why are you doing this, right? Or maybe yours is nice to you. Mine says dummy. Maybe yours is like, hey, it's okay. We made a mistake. I'm trying to retrain mine. I'm really working on that. Um, which is funny because I wrote myself a hypnosis script and I haven't recorded it yet because I do want to practice the self-hypnosis. But
Yeah.
if you are closed off, it's just like with the medication example, right? If you don't think it's going to help you, it's not going to help you. You have to be open to change and open to trying new things with a positive outlook on it for there
Mm-hmm.
to be an ability for anything to change. My mom has tried, I'm using air quotes, no one can see. My mom has tried to quit smoking
Mm-hmm.
85,000 times, right? And that's a highly addictive thing, right? But we see people that quit smoking that have been addicted, right? The difference is my mom does not believe, like she's literally tried hypnosis, she's tried the patch, she's tried gum, she's tried everything.
Everything. Yeah.
Um, she doesn't think she can quit smoking, right?
Mm-hmm.
She's like, well, I'm just addicted and it is what it is, right? And
It
that's
is what
kind
it
of the
is.
excuse, right?
Yeah.
Whereas my stepdad was like, he was a smoker. He smoked also for 40 something years, right? The day my son was born, he had said, when I got pregnant, the day Brent's born, I'm quitting smoking.
Mm-hmm.
And the day my son was born, when he found out Brent is now in the world with us, he threw his cigarettes in the garbage and has not smoked since then. And that was 21 years ago, right? But he
Mm-hmm.
knew it was possible for him. The same thing happens with the hypnosis, right?
Mm-hmm.
If we can admit to ourselves that our brain is auto processing 95% of our behaviors, right? Our thoughts.
Right.
We if we can admit that and say, well, even if I can only tap into 1% of that, it can work. One of the things I really like about it, though, is there's a really great example. If you think of hypnosis like this, right? So you think of your brain as like maybe you're going into your garage, right? Or you have a workshop, or something like that, right? You're going into this room and it's dark, right? And you're looking for something specific. Hypnosis is the flashlight. It's just the light. You're shining it. You are guiding it where
Mm-hmm.
you want it to point.
Right.
Hypnosis is literally just the flashlight to illuminate the thing that you're focusing on.
Mm-hmm.
And once you shift your focus, this even goes back to psychology, right? Like that priming effect. You buy a red Ferrari, if you're
Mm-hmm.
really rich, you see red Ferraris everywhere you go, right?
Yeah.
And it's the same thing with hypnosis. If we can shift that focus and say, okay, here's the thing, I'm shining the light on it. That's what I want to bring to the forefront because it's important to me.
Mm-hmm.
um, it can work for you. It's the same with diet and exercise, right? You have to be focusing on it you have to be doing it for it to work.
Yeah.
Repetition, it's all like muscle memory. So,
Yeah.
but
So
you have to believe that it's possible or you're not going to stick to it and it's not going to work for you.
yeah, right, right. Yeah. So you're right. Like I think we have so many words to describe different phenomenon, but it's not different phenomenon. There's words that some of us are comfortable with and there's words that some of us are not comfortable with. So there are a lot of people maybe I grew up in the Christian church, and historically it was like hypnosis is the devil. It's gonna, like, you're gonna have something bad happen to you or whatever, right? So that was a word that was like very scary to a lot of people who were coming from that background.
Yeah,
And
plus
so
everything you see on TV is that entertainment. Like I'm going to leave barking like a dog every time I hear a
right.
horn honk or something.
Like you're not gonna have control over yourself or
Yeah.
something. And that's all a myth. Like
Yeah. Yeah.
not it's not grounded in reality. But hypnosis, you're right, is really just a practice of attention. So some people
Mhm.
might be more comfortable calling it mindfulness,
Yeah.
right? Or calling it meditation.
Meditation.
Call it whatever you want.
Yeah.
Um, the practice of focusing your attention, like you said, with that flashlight on the part of your body that where the pain is, right? And then breathing out that pain. And slowly what that really does is it leads to that you relaxing that muscle that you're tensing up
Yeah.
because you're in so much pain. And so there's so many practices where you're just learning how to focus your attention on your body, on your breathing, on, whatever is going on in your life that you're trying to figure out. But there's a lot of research on the power of hypnosis for treating chronic pain. It's actually one of the most studied um, treatments, really, kind of like unconventional treatments for helping patients psychologically treat their pain. And it's because, like you said, it's focusing their attention away from whatever it is that's kind of causing this pain to feel more present. And so it's worth people giving it a shot, to try to practice focusing their attention away from that pain and maybe onto a new narrative, like you said, creating some
Yeah.
affirmations in through that, hypnosis process of, I'm not suffering because I deserve it. This pain is just
Exactly.
guiding me to whatever. There are many different stories you can come up with to describe your pain and give it meaning.
Yeah, the
Um,
only real difference between meditation and hypnosis is that mindset shift, right?
yeah.
With like meditation, we're just like, I'm thinking about my body. You're typically like, I want to release this muscle, I want to breathe, I want to feel my breath. Hypnosis just introduces suggestions to your subconscious, like,
Mhm.
I am worthy, I can live a pain-free life. Like, you're just reinforcing those or putting these new positive thoughts in place of those negative ruminations you've been carrying to help you shift that focus
Yeah,
into a different area, which can really be life-changing.
absolutely. Yeah. So I actually pulled up some um, realistic examples that we can think of for ways that people can make meaning out of their pain. Because I think when you tell people, like, you have to have a story about your pain that's going to let you carry it, to carry that pain. That's like so broad. Like, what do you mean? Come up with a story. I don't know what that means, right? So I was like, well, maybe we can give them some examples that might be helpful for them to think about their pain differently and maybe start thinking about what is the narrative that I have for my pain. Am I open to trying modalities that are outside of what I have tried normally, like hypnosis or maybe massage therapy? So I'm gonna go over like a couple of them, and
Yeah,
then we can kind of like talk
can't wait
about
to
it.
hear them.
Yeah, yeah. So the first kind of example is pain is often thought of as like punishment for some people. I deserve
Yeah,
this. I got myself here. Whatever that punishment is. But we can actually think about pain like not as a punishment. We can kind of change our thinking into pain. This pain is a signal. So we start to think of the pain of once you start to feel the pain or you start to experience, wherever it is in your body, you can say, oh, this is actually a signal, like a red light telling me to slow down, telling me I need to tend to myself, telling me to rest. So instead of looking at pain as this enemy that's against you, that you're fighting, you start to interpret that pain as a friend,
creating an
as
alliance with it.
right, right. So that's kind of the first example of like, how can I create alliance is a beautiful word. How can I create an alliance with my pain and think about it as a signal helping me to know when I need to pause, when I need to slow down. The other method that can give it meaning is thinking of pain as a teacher, as a spiritual teacher. So there are people, example, man with chronic migraine starts to journal what his pain days feel like on those days. Does it reveal something about my stress patterns, about when I get overstimulated? Is it bring up unresolved emotions for me? Do I start thinking about childhood or my marriage or my job or my friendships, or what am I thinking about when I'm having this pain? And so kind of being an observer of your own thoughts, and in that way pain becomes a catalyst for self-actualization. you know.
Yeah.
And so that is one way you can start to kind of think of pain is not as an enemy or as something to be fought against or something to try to get rid of, but being in alliance with it. And there's this paradox that the more we are in alliance with our pain, the less we start to feel pain, right?
Yeah. I think that also just is a good reminder that um, our emotions can manifest physically. I think we've all had like a heartbreak that has like your stomach is in knots, right? You get those butterflies, you literally can feel that emotion in your
Yeah.
body. When you start to get upset, you can feel that heat rising in your chest, right? You feel your chest tighten, you can feel
Mhm.
your heart starting to increase. And so our bodies carry so much of our emotion, and I think we don't like I am kind of tuned into that, right? I tend to recognize the body change before I'm like, am I getting upset? Am I getting
Yeah.
upset? What is my body trying to tell me about my mental state right now, right? And
Yeah.
sometimes it's like, no, you just need to eat. Like that was my,
Yeah.
my
Yeah.
stomach is just
That's
growling
That's a
because
common
I'm
one for
angry.
me. That's a common one for me. I'm like, "Oh, am I, like, really angry right now about this, or am I just hungry?" Like
Yeah. Yeah. So I think that one of the things that I find very interesting also about massage therapy is that it can help with a lot of those like emotional releases.
Mhm,
Um, a lot of people can and will have an emotional response to that physical touch.
mhm.
And I think that could be very powerful and very healing in the right circumstances. Obviously, you would need to have that
Yeah.
relationship with your therapist, and maybe go in with those intentions. Right, setting an intention is also very important. Just like hypnosis, you got to believe it's going to work. You want to set that intention going into it. Like, what do I want to get out of this today? Am I just trying to relax? If I just been carrying a lot lately, and I just want to be able to, get it out. Um,
Yeah, absolutely. One of the ways that we actually assess anxiety in children, is we ask about stomach aches, because kids don't have the ability yet. A lot of them don't have the ability yet to communicate their internal experience. They don't know that they're anxious. They just know I'm nauseous. I have a stomach ache. I don't feel good, right? And so you see parents who get, real worried. They take their kids to the doctor. There's no medical issue going on, but they keep getting stomach aches right before school, or they're getting nauseous right before a big game. They don't want to go to soccer practice anymore, or they don't want to play. And it's like, oh, this is anxiety. Yeah, let's start to teach them and help them communicate. Hey, sometimes you can get a stomach ache or a headache, or your heart can beat really fast. And so, like you said, this is a very emotions are embodied experiences. They are happening in your body, and that means you're having physiological changes that occur, and then you assign meaning to those changes.
yeah,
So most people go through their life, and they're not embodied. I would say you are very embodied, and you do a good job. I am not. I spent most of my time being very dissociated from my body, so it can be very overwhelming for me sometimes, even to like get back into my body and let myself feel all the physiological changes that are happening in response to an event or in response to whatever it is that I'm doing. And so this practice of getting in your body, of touching your body, putting your hand on your heart, is what we call a somatic therapy. And it's so important for people who are not used to feeling their bodies, who are actively avoid the experience of those physiological changes. And so, like, I think you're right that massage can be a good place to safely start that practice of feeling your body, being in your body, being able to say, yes, it hurts there, or that's too much pressure here, even communicating to your therapist, about what is uncomfortable and what is comfortable, because it means you have to know what's happening in your
yeah.
body to be able to explain that.
My instructor has a theory, and I'm so excited to become licensed and kind of take on this study myself, right? So She
Yeah.
has been a licensed massage therapist for 15 years. She said that she personally notices the clients that are requesting deep tissue for relaxation are
Mhm.
typically the clients that also have a hard time being in touch with their emotions or releasing emotions. Like they're
Yeah.
not in tune with that. And so it really takes a lot of pressure in their body to get them to feel like it to a relaxed
Mhm.
state, where someone that's more able to, cry when they need to, or
Mhm.
just feel their feelings, don't need as much of a forceful physical release to get that same level
Yeah.
of relaxation.
Can confirm.
Yeah, I was like,
Uh, yeah, so from a not only from a personal level, but, just 'cause I have experienced so much, like, disembodiment with myself. It took me a long time, a lot of therapy to, like, really get into my body and be able to, like, just feel. But I know from a psychological perspective, like we do know that people who are more disembodied, for example, they will take showers that feel like lava, right? They require like really, really hot showers. They do really well with things like tattoos, right? Tattoos don't bother them at all. Like they could probably go to sleep while they're getting a tattoo. Um, so this they're able to dissociate from their body in a way that requires they need more stimulus, more
yeah,
pressure stimulus, more pain stimulus. And this can go even into a more interesting psychological topic when it comes to like sexual activity and the amount of stimulus that people need as it relates to their embodied experience and being disembodied. But there's so much psychology there with comfort in the body, and how that can lead to kind of the capacity to mistreat our bodies because we're so disembodied from them.
is this going to be our first two-parter?
Oh, it
Oh my
might
gosh.
be.
Oh my gosh. I feel like this is like to be continued. Like I
Yeah.
feel like that is a excellent next week. I think we should definitely dive into that some more. I think
Yeah.
that'll be
Yeah.
really interesting. So,
Yeah.
um
100%. Yeah, we'll do it. We'll do it. So, I guess to kind of close this one out, pain is something that we can make meaning out of, and the goal of managing that chronic pain is to think about our narratives about that pain, and really evaluate what kind of story we want to tell ourselves about that, and then maybe taking the chance of trying some new modalities that you haven't tried, like hypnosis and massage, and
yeah.
you know giving yourself the
And
opportunity to try it.
yeah, and recognizing emotional distress can present as physical pain in a lot of cases.
Yeah, I would say most of the time it
Mhm.
does. Yeah, yeah,
Yep.
100%. So, anyway, we're already at an hour.
All
I don't know how
right.
an
Oh my
hour went
gosh,
by.
that's a good wrap up point. You know what? I was waiting for the day we had a two-parter, and it's happening a
We
lot faster than I thought. So we're good. We're
It
good at
happened.
talking. If
It
anything, we're
happened.
good
I
at
don't know.
talking.
We are good at that. We are good at that.
All right.
All right.
Well, thank you guys. We'll see you next week.
All right. Bye.
Bye. Love you.
Love you.